I work with a number of patient advocacy groups in NPC, I would say. Most notably the NMPDF, National Niemann-Pick Disease Foundation, which I think plays a strong role in advocacy and patient support. They have a meeting every year. And then also the Ara Parsegan Medical Research Foundation is predominantly a research organization, but they do bring people together, you know, to discuss scientific discoveries and promote connectivity. They held the patient-focused drug development meeting with the FDA that we had a couple of years ago. And then then NPUK has interacted with me a fair amount. That's the Niemann-Pick organization of the United Kingdom. They have a meeting yearly, and they support families. They do advocacy. NMPDF also has a program to, if families no longer need certain equipment, you know, then they can give it to other families through the NMPDF. And so they do stuff, they do things like that to support families. They bring families together. If you're a new diagnosis and you want to talk to somebody, there are routes to do that. And so I think all of these organizations work together to provide support. And then there's a big international organization, the IMPDA, which includes different support groups from different countries all over the world. And they try to overlook at what are the overriding issues between all the countries, like the barriers to drug development and things like that, and come out with ideas and processes. There's a registry that called the IMPDR, which has come out of the IMPDA, and it is doing. I think it's very important to have the registry. It's been a little bit difficult to get it going in the USA, but that's another support that the organizations are doing for the field to try to help with collection of natural history data regarding patients. Because in the end, I think it's very difficult to do a clinical trial and show a change in the progression of NPC over just a year, because it takes longer to show definitive change because there's so much variability in the disease. So it's going to be very important for us to have good natural history so that we can look over multiple years and show that something is impacting the disease with good comparators from natural history.